Hi, my name's Katie,
Hi, my name is Jasmine.
and we're both student physical therapists at Advent Health University, and today we're going to teach you how to fit assistive devices for your patients.
Okay, so today I'm going to teach you how to fit a standard walker. This one does not have any wheels. To fit this walker, we're going to use Katie as a patient. So to fit her walker, sometimes we'll ask for the height, but we're just going to go rewind it all the way back. So she's standing up. I'm going to place the walker in the inside. We first want to make sure that the equipment is durable. We want to make sure the rubbers are all good, that the patient has on proper footwear, so that can be in the hospital, rubber socks, or tennis shoes. We want to make sure that the walker is inside of her, and we want to ask the patient to stand up straight and make sure that the wrists fall evenly. So this walker could go up a little taller because we want to make sure it goes on the inside of her wrist. It falls in there, in the handlebars. So I'm going to go up one notch. And for what you do for one leg, you have to do for all 4 legs. Okay. You can still go up one more, maybe one more. And Katie's 5'4", 5'3". But every walker is different, so what may fit for one walker, she's usually on 4, may not be for every walker. All right, so that looks good because it falls on the inside. So I'm gonna have her grab onto the handlebars. She has, thank you, 20 to 30 degrees of elbow flexion. And that's how you know that the walker is fitted properly. Okay, next piece of equipment is our small base quad cane. This is different than a single base quad cane because this has a little box and then it has 4 legs on it. So I'm gonna fit this for her left side. To know it's for the left side, you have this little line rigid area, and that's so the base is more stable. And this is similar to our walker. We wanna make sure that this top handlebar falls on the inside of our wrist, as well as we want that 20 to 30 degree elbow flexion. You can switch it to the other side. So this is fit for the left side. You can switch the handlebar by turning this loose, and you just move the handlebar. And then make sure everything is tightened as well. And you want to make sure the rubbers are good as well. So I'm going to have Katie just put this in her left hand. And I'm going to have her stand up straight. I would go up maybe 1 knob. So it's just like a walker. You just want to pull. So you want to loosen this first. Then we'll go up 1. This is not a good one. I got stuck. Okay, there we go. And then tighten it. Right, so it looks about good. I'm gonna have her hold on to this handrail. You wanna make sure she has that elbow flexion, 20 to 30 degree bend. And that is all.
All right, today I'm going to teach you how to fit axillary crutches for your patient. So first we're going to start out asking what our patient's height is. Jasmine, how tall are you?
I'm about 5'7".
5'7". Okay. A good way to estimate the height for crutches is you're going to have the patient put one arm straight up like this at a right angle and then stick this arm out, and it should be approximately the same length. All right, Jasmine. There we go. Now this looks a little too short, but it is at 5'7" on the crutch. So this is just a reference to go by. You don't want to go solely based on this number right here. So I'm going to put this up maybe 2 notches. There we go. There's 1. And then you also want to remember, you don't want to put the part at the bottom on the floor. You can always put it on the top of your foot to keep it off of the nasty floor. There we go. So right now I have it at 5 and 9. We're going to test and make sure this is a good height for Jasmine. So I'm going to have her put these under her arms. And to fit, I'm gonna put 2 fingers right above here. Make sure it's not too much space. Right there. And I'm also gonna have her put her arms to her side. And make sure this falls right around the wrist. And now put your hands up. And we should have about 20 degrees of elbow flexion. Right there. And then if that is not an appropriate height for your patient, you can adjust the handles here. But that looks pretty good. And then you also want to remember for your patient when they're walking with crutches to keep those arms nice and tight up here so they don't slip and fall.
We hope you enjoyed the video and found this informative. It is very imperative to your patient's success that you make sure that the equipment is fitted properly for their safety and just for the progression in their journey. Thank you.